goals of therapy in polycythemia vera are beyond just controlling the red blood cell count. The goal is to control the red blood cell count, white blood cell count, spleen, platelets, and symptoms, and follow a trend for a possible change. It is not that disease is always static. It does change over time. If there is a trend for a change, we may be talking about advanced polycythemia vera, where we lose control of these factors. It is very important in everyday practice to pay attention when we treat polycythemia vera patients, not only on the control of the red blood cell count and aiming for hematocrit below 45%, but also to look at the increased white blood cell count. This is now more or less a standard practice, and it's built in our guidelines how to manage polycythemia vera patients, because there is a very large evidence from multiple reports that progressive leukocytosis is a risk factor for thrombosis. White blood cell count in particular is a good target for therapy, even in the cases where red blood cell count is controlled well, because of notion and now data showing that increased white blood cell count is independent risk factor for thrombosis. Polycythemia vera has two aspects to it. One is the proliferation of the blood cell count, but the other aspect is inflammation that comes with polycythemia vera that can affect the well-being of the patients. After all, this is a myeloproliferative neoplasm that affects red blood cells, white cells, and platelets to equal extent. And it's a myeloproliferative but also inflammatory condition that leads to increased risk of thrombosis, but also to poor quality of life. Polycythemia vera-related symptoms are something that we should be assessing in our everyday management of polycythemia vera patients. I'm talking about itching, night sweating, low-grade fevers, abdominal fullness. Many times, the quality of life or a presence of polycythemia vera-related symptoms is actually tied to uncontrolled proliferation. If you have increase in white cell count, you require too many phlebotomies to decrease the red blood cell count. That is usually manifested in a bad quality of life or polycythemia vera-related symptoms.